Good evening, ladies and gentlemen. Welcome to the webinar of Post-COVID Breathlessness powered by Jaldee.com. So we coordinately invite every single attendees to this webinar today. Let me introduce myself. I am Abhijit from Jaldee.com. Before moving on to the main part of this webinar, I would like to give a brief introduction about Jaldee. Jaldee.com is a platform. Jaldee.com is a platform for connecting doctors and patients seamlessly with the help of technology. And Jaldee.com is one-stop tool for patients to get connected with the doctors of various divisions like Ayurveda, Homeo, Allopathy, and other medical practices. Maintaining your health is really important, and Jaldee makes it easy for you to connect with the doctor for expert advice. Even during this pandemic, you just need to visit our website or Jaldee app today from Play Store and App Store for the booking. We shall post the links of the same in the chat. Before I inviting our keynote speaker, Dr. Colonel K.E. Rajan, I would like to give a brief introduction about him. Presently, he is the professor and head, Department of Pulmonary Medicines in Sri Uttradam Tirunal Academy of Medical Science, Trivandrum. He had completed his MD in General Medicine and Respiratory Medicine. He is a past commissioned officer in the Indian Armed Force and served over 27 years in the Indian Army Medical Corps and retired as professor and head of the Department of Respiratory Medicine. He served as a professor and general medicine at the SUT Academy of Medical Science, Trivandrum. He also served as the professor of pulmonary medicines at SR Medical College and Research Center. Adding to this, he has over 40 publications in various medical journals and a contributing author for medical textbooks. He is currently peer reviewer of scientific articles of medical journal Armed Force India. So this is a subject in which we should all be deeply interested because amidst this pandemic, what else is the more important than taking care of your health? Without much wasting of time, ladies and gentlemen, please help me to welcome Dr. Colonel K.E. Rajan to this virtual stage. Over to you, sir.
Okay, thank you very much. In fact, indeed, I'm grateful for that introduction. How do I share the screen? Is it visible?
Yes.
Now we can.
Yeah. Okay. So thank you very much for that introduction. Without wasting much time, I think we should move down. The presentation now. Wait. Yeah, as you know, the coronavirus is called corona because it has got a halo, as you can see in the picture, a halo around the virus. So that gives it the name corona. And based on our symptoms and signs, we divide into category A, B, and C. So I've just put it here. The vast majority of patients, almost 90%, will have only A, that is mild sore throat, cough, rhinitis, that is running from the nose, and loose motions. Then B may have fever, severe sore throat, cough, diarrhea, lung, heart disease, AIDS. Then people who are on long-term steroids, pregnant ladies, and those above 60 years are considered as severe one. So in a case of corona, the mild or the moderate one, the severe one is beyond the scope of our discussion because that will be only handled in an ICU. So anyone developing shortness of breath, that's our day's topic. No need to panic. If a pulse oximeter is available, keep a watch on saturation and see whether there's any drop in saturation after walking for about 3 minutes by the watch. And sitting quietly, you can feel your breaths. Look at your watch touch your tummy and see how many times it rises and lowers. 18 up to 20, okay. Anything more than that, you have to get medical help. Now, if you develop breathlessness and is diagnosed with corona, it's always better to sleep on your face or on your side rather than sleep on your back like that. And of course, take nutritious food, but not very fried items and hard to digest, but nutritious food and enough hydration. Just to be emphasized, especially elderly people, because they fail to take adequate hydration, fluids. So this is just a nutshell about the minor symptoms, hair fall, chest pain, allergic reactions, headache, cough, body ache, skin reactions. Any combination of this may be there after COVID. Right. So we doctors call it as the post-COVID-19 syndrome or long COVID syndrome. As I have already said, vast majority of COVID-19 recover completely. As on date, more than 3 crores of Indians have recovered. All over the world, around 6 crores plus people have recovered. And a minority of patients will have symptoms after recovery. And these symptoms include unexplained fatigue, severe feeling of weakness, shortness of breath are major topic, cough, feeling heaviness, and chest pain off and on, joint pain, feeling of heartbeats inside your own chest, that is called palpitation, muscle pain, headache, loss of smell and taste may be there during the active phase as well as post-recovery. Memory, concentration or sleep problems may be seen, rash or hair loss may be seen, and a small group of people even develop psychiatric problems. So that is so for non-doctors in the crowd, this is the area of discussion today is this alveoli. What are alveoli? There are sacs, as I have depicted in the picture here. I hope the picture is clear, sir. Ramesh, sir? Picture is clear?
Yeah, the picture is clear.
Thank you. So the trachea or the windpipe divides into two and then divides 19 to 23 times to reach in this stage. And they finally end up in small bubbles called alveoli. There are about 300 million, 30 crores of them inside us. If you were to put them side to side, you will fill a whole tennis court. So this is where the activity occurs. So this is what exactly happens in a COVID pneumonia. On the left-hand side of the panel here, the clear sac, I have represented one sac. This is from Wikipedia. One sac which takes the air in and the blood is coming around it, which absorbs the oxygen, leaves out the carbon dioxide. This is the basic function of the alveolus. Now here, on the right-hand side of the panel, you can see a black sac, that is sac filled with fluid. And here, the air is not able to come into the sac and it is preventing oxygenation of blood. So that's what exactly happening there. So, putting it another way, if the top panel here, top circle here, is a normal air sacs or the alveoli, the bottom one filled with fluid. So in the case of bacterial pneumonia, it will be purulent, pus. In viral pneumonia, it will not be pus, but it will still be fluid, and this fluid will prevent you from properly imbibing oxygen from the air that you have taken in. So this is the normal X-ray chest of a lady, 23. Unmute me, please. Okay. I'm audible, I suppose. Yeah.
Yeah,
so,
yes. Yeah.
Both the lung fields are clean. Here, this is a heart in the center, and you can see all the ribs very clearly. This is a normal X-ray chest. Against that, see this. This X-ray here, there is a white patch. There's a small white patch here, very early stage. Now on the right panel, more dangerous signs are there. It's another patient. And if you go down, so further more white areas you can see on both sides. And there's an advanced stage where virtually the left lower half of the thorax is useless. So it's a very severe case. Now here I have given examples of how the CT scan appears, what we call as ground glass opacities and crazy pavement appearance. This is what we are referring to. And based on the CT scan, we have got a scoring system. So you can see the ground glass. Ground glass means that semi-opalescent glass. And multiple areas of traction, bronchiectasis also you can see here. Here, there are patches here. Now, if I show you the vertical reconstruction, you can see the ground glassing here. And fibrosis there is evident. Here again, crazy pavement appearance is very evident. This patient was graded as 13 score out of 25. That is fairly severe. And these are vertical reconstructions, as I said. So this is what we find in a CT scan. That's why we do a CT scan. So in severe cases, depending upon the individual condition, they are usually given oxygen. If the pulse oximeter is more than 94% room air, no need for oxygen. But if it is less than 90, definite need for oxygen support. So it may be by a mask, or by a cannula, or by what we call as high frequency oxygen delivery systems. Then we use steroids like prednisolone. Then we do give clot prevention agents, anticoagulants like heparin, rivaroxaban, apixaban. Then in admitted patients, we use antiviral agents like remdesivir, you would have seen in papers, favipiravir, and it's an expensive item. It's a monoclonal antibody. MAB stands for a monoclonal antibody, tocilizumab, which is supposed to reduce the attack of COVID on the body. Then now we have got what is called an antibody cocktail and interferons. There's a therapy is also being supported. Then finally, we may think of ventilatory support. This is what we do. Now, what happens once the patient recovers? There is what is called scarring of the lungs. So the scarring of lungs leads to reduced quality of life and restricted activity. And then there is fibrosis leading to home oxygenation support required for some of the patients. Then because of the lung, the heart is secondarily involved. It is called cor pulmonale or pulmonary heart disease. It's a complication of severe lung diseases. And there could be pulmonary thromboembolism, means a clot formed in the legs or somewhere else gets lodged into the lungs. So that's called pulmonary thromboembolism, which prevents naturally blood from reaching the lungs. And there is not even what do you call, blood clots are formed inside, and that also prevents normal oxygenation. Now, post-COVID evaluation, what can you do at home? You can take check on your respiratory rate, record finger saturation, record the distance you can travel, preserve the X-rays for comparison, and how many seconds after a deep breath till what you can count. And take a breath, and then how many seconds you can hold the breath. All this is assessing your function at home. Doctors, we will suggest X-ray test, pulmonary function, blood and sputum test. Pulmonary tuberculosis is supposed to be looked for in every case who is recovered from this COVID and has got some symptoms. And of course, you have to check for other causes of breathing difficulty like cardiac failure. So that's also a must. Now, this is a very important point. Post-COVID, how much exercise can you have? Now, a recovery with a negative antigen test or recovery with a negative RT-PCR test does not mean that you are normal. You have recovered, all right, but the after effect of the virus attack is still there in you. So please be patient. Exertion should not be heavy. Light arm exercises, breathing exercises, including pranayama. You should not do strenuous exercise like weightlifting or treadmill or cycling, you would have read in papers about the unfortunate loss of the Indigo Airlines boss. So allow the body to recuperate completely over 3 months' time and take a balanced diet as well as adequate fluids. That is very important here also. So now a word about prevention. The best way to prevent being exposed to the virus. So SMS, soap or sanitize, wear a mask, maintain social distance, wash your hands well. Then, especially after going to the bathroom, before eating, blowing your nose. If soap and water is not available, your sanitizer should have at least 60% alcohol. Remember that. And then always wash your hands with soap when they are dirty. And this abominable habit of using saliva to count currency is very bad. No one should do that. So avoid close contact with people. Stay home when you are sick. Cover, cough or sneeze. And report travel history to the district health authorities. That's what you should all do. See, suppose you are going to sneeze, no kerchief available, sneeze or cough into your arm. That is what you should do. Into your own elbow, which will prevent the spraying of secretions across several meters. We'll skip that. Vaccination. All approved vaccines, whether it is Pfizer, Moderna, Covishield, Covaxin, or now Sputnik, all are 100% efficacy in preventing death due to COVID. They're very high efficacy against severe COVID, high to moderate efficacy against symptomatic COVID, and poor efficacy against asymptomatic COVID. In other words, taking vaccine means you are likely not to have very severe disease, likely, but that doesn't mean that you will not get asymptomatic. I'm vaccinated with 2 doses, but I still can have COVID, bring it home and give it to my family members, children or grandchildren who are not yet vaccinated. So do not run after efficacy of data. Use any vaccine whatever is available. Now, everyone, including lactating mothers, elderly, should get vaccinated. Nasal vaccine, which are coming now, like intranasal vaccine of Bharat Biotech, which is undergoing phase 1 trial, may be able to help prevent the infection in toto, but so far it's not available. So the children, the trial has started. Now, this is very important. Often I get questions asked, should my pregnant daughter, my pregnant wife be vaccinated? I think yes. 10,000 pregnant ladies were vaccinated in USA and studied, no additional side effects up to 3 months of follow-up. And of course, first baby born with COVID antibodies, the sweet little thing was inside her mother when the mother got the vaccine. And once she was delivered, we found that she has got antibodies. So please use that. Now, what is the contraindication? Which are the conditions where you should not or need not or should never give vaccine? It is severe anaphylaxis to either a COVID vaccine or a non-COVID vaccine. What is an anaphylaxis reaction? Take the vaccine, the person falls down or becomes unconscious, and he gets to go to the hospital where he is resuscitated. Such cases, one should not take vaccine. Barring this, anybody, yes, if you are having temperature over 38.5 degrees Celsius, postpone vaccination till February. The past history of COVID must go for vaccine after 3 months. Now, people ask me, food allergy, latex allergy, anti-venom allergy, non-COVID vaccine allergy, no problem. Safely take COVID vaccine. But tell your caregiver that you have got allergy so that he can advise you. Especially those of us who are people who are having asthma, I advise them to take a tablet of Montelukast the day prior to the vaccination. Now, if a person is hospitalized for severe disease, take the vaccine 4 weeks after recovery. Diabetics, yes, take their morning medication, take their breakfast and then go. If the person is on corticosteroids, for example, arthritis, you're taking corticosteroids, then the daily dose should come down to 7.5 milligram per day and then only take vaccine. Those who are taking spray, that inhaled steroids, still can take vaccine. There's no problem. But if, say, you are taking any other vaccine or you have just taken any other vaccine, there should be a gap of 14 days between COVID vaccine and any other vaccine. 2 weeks. Allergy, bronchial asthma, skin allergy, all can be vaccinated. But if you are on a drug called methotrexate by any chance, then stop for 2 weeks and then take the vaccine. If somebody is taking rituximab, for 4 weeks, you should not be vaccinated. Person treated for blood cancer, wait for 3 months. Planning surgery, take the vaccine. Autoimmune disorders, take the vaccine. Older people, they should be encouraged. Bedridden people, sitting at home, but they are very vulnerable, so please give them vaccine. Dementia, paralysis, neurological disorders, vaccine is a must. Stable kidney disease, stable cardiac failure. Immune response may be poor in them, but we have to give them vaccine. Covishield is preferred for immunocompromised people, for example, HIV. Now, if your person is taking aspirin and clopidogrel, doctor, can he take vaccine? Yes, but don't stop aspirin and clopidogrel. Sorry. So, well, to conclude this short presentation, COVID-19 is here to stay, at least for the next year. There is no need to panic. The situation is improving on a daily basis. Active cases are declining. In most states, except in the Northeast, all other states, the active cases, the positivity rate are coming down. Follow all safety precautions. No complacence. Effective treatments are under development, including 2,3-DG glucose. Vaccination is effective and safe. Encourage all to get vaccinated. Unless there is a contraindication, that is the danger which I mentioned to you. And no to tobacco. And that is myself on the Antarctica while I was in the army. Thank you very much for a patient listening. Any questions?
Thank you very much, Doctor. So now we can
Start the questions. Yeah.
start the questions. Yeah. So who wants to start?
Anybody?
Mr. Shivakumar, you want to?
Yeah, please come on the screen.
Sir, my auntie, can you listen me?
Yeah.
My aunt, who affected by mild COVID, she hospitalized and now she came back. Now we are going to complete the 14th day. Is that sufficient?
90 days. 90.
No. She got treatment for COVID mild.
Okay.
Mild moderate. She came from hospital. Now this is the 12th day.
Oh.
Can we stop the home isolation?
Yeah.
Can we do the normal routine work?
Yes. No heavy lifting.
Okay.
Bucket full of water, clothes.
No. Okay.
Climbing, say, to the 3rd floor, to the terrace.
No. Okay. No.
No coconut, skinning.
Okay.
Nothing of that sort.
Okay.
Where the rule of the thumb is, if you don't have to hold your breath, anything where you don't have to hold the breath. Say, if I pick up a pen, I don't have to hold my breath.
Okay.
But if I pick up a bucket of water, I have to hold my breath.
Yes.
Anything where breath holding is not required, they are permitted.
Sir, and one more question I am having. That is, she is not sleeping in nights.
Yep.
She is 78 years old, recovered, and now still she is not taking sufficient food as far as our concern. She is not eating well, and she is not having a good sleep. What we have to do?
See, the Does she rest during the daytime?
Ah.
At 78,
Ah.
your total sleep in 24 hours is only 6 hours.
Okay.
So if she rests, even if she does not sleep according to her, if she takes an hour nap, that goes out of her account at night. So at 11 o'clock, she may go to bed, but at 4 o'clock, she'll wake up.
Yes, sir.
So as far as possible, she should not sleep during daytime.
Okay.
At night, give her a glass of milk.
Okay.
Or any protein powder.
Okay.
Ensure that all those deep protein, anything.
Yes, sir. Yes, sir.
Because that induces certain sleep-inducing agents in our brain.
Okay. Okay.
I will not give sedatives at this age because it is dangerous. They will go and fall down.
Okay, sir.
Right.
Sir, please, one more question. For sleeping, you given this suggestion, and how to improve her health because she is feeling tired during this COVID mild, moderate. How to overcome from this, and she is having that we are having this mental agony, I think. What to say?
True. A proportion of the elderly will develop psychiatric problems. This is known that you can't help. So we can only give her support, tell her, Amma, you are perfectly all right. Doctors have all said that. And then spend some time. Leave somebody in her room. Don't leave her alone. These are the things I can suggest. Otherwise, you may have to get a psychiatric help for a mild anti-anxiety agents.
Okay, sir. Okay. Sir, and sir, now shall I remove this face mask in house?
Inside the house, she can go without the mask.
Okay. Thank you. Thank you. Thank you.
Doctor, we have some questions that's on the chat box.
Yeah.
So one is from Jyoti asking, should those who doesn't have respiratory problem during COVID, do they need to take a chest X-ray after getting negative?
No, not required, sir. See, if the person is having no symptoms, Jyoti, I hope you can hear me. If the person has no symptoms, no breathlessness, able to walk normally, sleep, eat normally, no further testing is required. It is not productive. We don't advise X-rays. Even X-rays are supposed to be not very good, to pass through your body. So unless it is really needed, I will not advise an X-ray. Yes, if there are any symptoms, do get in touch with a doctor. If you want to do a blood test, the safest is C-reactive protein. C-reactive protein, CRP. You may check, because that will reassure you that I am all right. The laboratory value, normal value is given there, usually below 5 milligram. And if it is shown, so then you feel comfortable. If at all you want, don't go for X-ray.
Thank you, doctor. Srimati R. Vimala Devi is asking, when can singers resume singing? Pranayama and Kriyas, when can they be started?
Pranayama can be started immediately after recovery. There is no harm. Deep breathing exercises, even cupping the hand like that and like that. Cupped hand percussions you can give home to your relatives. Others can give. That's good. Plenty of warm fluids you can give. That is again no problem. Say small, if it is a singer, means I expect the person to be having a kacheri, say an hour-long kacheri. No, not immediately. That of course it should take some time. But maybe singing a bhajan of 3 minutes or 2 minutes where the person does not become breathless, that's permitted. Otherwise, let her do some pranayama, then regain her full capacity of the lungs. As I mentioned on the slides, see whether you can hold the breath for 60 seconds. Then your lung capacity is excellent. 40 seconds, average. 20 seconds and below is poor. So that will give you an approximate idea. So take a deep breath, look at the watch, if the person is able to hold the breath for 60 seconds, then I think she can resume her singing sadhagam and, whatever rehearsals or whatever.
Thank you, Doctor. Mr. Ummu bint Sheikh is asking, some physicians have been recommending a dose of clopidogrel a day before getting vaccinated for Covishield.
Yeah.
Since it has been associated with clots.
Yeah. So see,
is it rational, sir?
In fact, we have, in modern medicine, we do what is called double-blind controlled trials. Means we should have a group of at least 100 people taking clopidogrel, 100 people not taking clopidogrel, then compare how many have developed clot. Now, this clot problem has been, after vaccination, seen only in Europe, and that too among very elderly people. Among Indians, for example, under my own jurisdiction, in my college, I have about 600 medical students, then 300 medical workers, and another 200 consultants. Among none of them had any major side effect to vaccination. So, to make everybody eat clopidogrel, I think is not practical or correct. A. B. A single tablet of clopidogrel is not enough to bring down your chance of clotting. That is why in heart attacks, we give 4 tablets at the same time as a loading dose. Otherwise, one single tablet is not going to be of any use. Yeah, what is the question?
Yes, thank you, Doctor. So next question is whether, from Jyoti, whether any special blood check is needed post-COVID phase for those who doesn't have much severe COVID symptoms but had fever, body pain, intermittent cough.
Yeah, that's what I told you. See, to make sure that everything is okay, a CRP test is advisable. It's only about 200 or 300 rupees. C-reactive protein. If that is normal, then nothing further. If that is elevated, then you may get in touch with a doctor.
Okay, thank you, Doctor. So, Mr. Ummu bin Sheikh again. Can we suggest proning for mild post-COVID chest pain?
Yeah, as I have given in one of my slides, people with breathlessness and lung involvement are asked to sleep on their face. That's called proning. This is the prone position. This is the supine position. That is what we teach in our anatomy classes. So proning means lying on your face. That is definitely advisable. In fact, man is the only animal which sleeps on its back. No other animal sleeps like that. So the most natural method is to sleep on your face, but it is advisable. Then what was the next question?
This is from Mr. Ajit Mahadik. Doctor, I had 2 doses of Covishield vaccine, but infected COVID-19 and completed medical treatment and 14 days of isolation. He didn't put any questions on that. So he had 2 doses of COVID vaccine, but infected COVID-19.
Yeah.
But now that he's recovered.
Thank God for that. Sir, there's a major hospital establishment here in Trivandrum district, the private hospital, where they have got 1,200 medical and paramedical personnel who were given both doses of vaccine, but they were again re-exposed, naturally in the hospital. As high as 10% of them, that is 120 of them, caught COVID. My point is, as I said, the vaccine is not going to prevent the infection. Now, to give an example, it is like waiting for the thief inside your house. Let the thief come inside, then I will kill him, right? But the nasal vaccine which is coming can block the thief at the gate, prevent him from entering your premises. But that this vaccine does not do. So we may develop, but most of us who develop after vaccination, unless we have got some disease like diabetes, I'm sure some of you would have heard, we lost a very dear physician colleague, Dr. K.K. Agrawal, very famous person, president of IMA, a physician. He had 2 doses. but he succumbed to COVID. But unfortunately, he had other diseases. So I don't know whether this gentleman is talking about a person who has no other disease, diabetes, for example, heart disease, for example, liver disease, kidney disease. All this worsens your chance. So you can.
Don't have diabetic or BP.
No, so it is possible that your body has not responded like the 99% of people who receive it. That's all I can say, sir.
Shall I go for CRP or any other test?
Yes, sir, you can. Yeah, you can do a CRP test. There's no harm. And I'm sure during hospital stay, they would have checked your X-ray and CT.
No, sir, I'm not gone for that one.
So that means it was not, it was only category A disease,
Yeah.
basically very mild. Yeah, CRP you can do, sir. There's no harm.
Okay, thank you, sir. Thank you. Thanks a lot.
Ms. Smita is writing, my 89-year-old mother recovered from COVID about 2 weeks back and suffers from breathlessness and swollen feet and face. Would you recommend a CT scan for her?
Now, breathlessness.
She finds it painful to place her leg on the ground. What could be the reason?
For the first part of the question, sir, before jumping to the CT, I would rather advise an X-ray chest, PA view, because if the X-ray is clear, CT may not be useful. You can do a CT, there is no harm, but then you are exposing the person to almost as many as 6 or 7 X-ray doses compared to plain X-ray chest, number one. Number two, swelling of feet is known to occur to anybody above the age of 70, 75. That is because the heart has to pump blood down, and with the pumping of the heart, the blood has to return. So for that, what you have to tell her is to keep the leg elevated on a pillow or put 2 bricks underneath the cot at the foot end, so that during night her feet will be at a higher position. Now, why it should not, she's not able to put it down, I am not able to guess. Most probably it is a painful arthritis, which is osteoarthritis, which is very possible at the age of 80. So I think medical help, showing her to a physician would be good.
Okay, thank you, doctor. Mr. B.M. Swami is writing, patient was in ventilator for more than 20 days. Oxygen flow through tracheostomy. Now he's at home. What we should take care at home? What complications will come post-COVID for him?
Yeah. The dreaded complication is post-COVID fibrosis. If the treating physician has given him advice to continue anticoagulants like apixaban, rivaroxaban, or what is it, acetron, please continue that. Or some physicians might have put him on aspirin clopidogrel combination. Please continue that. Let him do mild exercises, deep breathing exercises, and keep checking with a pulse oximeter twice daily at least the oxygen levels. On room air, it should be above 92 to 94. If then, nothing to worry, and he should not get exposed. So it would be preferable him to wear a mask at least when others are there in the room, in the same room. And the number of visitors, the number of functions that he is asked to attend, etc., should be minimized so that there's no chance of a cross contact. And if the CT earlier during ventilation time, they might have taken several CTs. Then if that has shown some fibrosis, there is some studies going on now whether pirfenidone, drug pirfenidone, or nintedanib is a drug which can reduce fibrosis. So that depends upon the treating physician to take a decision in consultation with the respiratory expert whether this gentleman will need nintedanib or pirfenidone for continuation. Both are expensive, The follow-up is rather difficult. So both has to be taken in consultation with a physician.
Thank you, doctor. R. Vimala Devi is writing, post-COVID, I am on Pradaxa dabigatran since I am diabetic.
Yep.
How long should it be taken? Are antifibrotics like Fibridone or statins useful?
Again, as I said, antifibrotics have not been conclusively proved. Statins, if you are taking for controlling your cholesterol, no harm. Statins for pulmonary fibrosis, again, not proved. People have suggested, but not proved. There is no harm in taking, I suppose, but then the cholesterol will improve. About dabigatran, usually we ask them to continue for 4 weeks, then come back and check. And then if there is no evidence of any clotting anywhere, then the physician can consider whether to continue. If, say, for example, the person has already got atherosclerosis or heart disease, we may continue that. Or the person had a clotting in the legs, what we call as deep vein thrombosis or thrombophlebitis, we may continue that. So that will depend upon the physician. Usually 4 to 8 weeks we give them. And the last drug, Pradaxa, again, when we go for review with the physician, that's the time we can discuss with him.
Thank you, doctor. Pranati is asking, how can COVID-19 cause you to lose?
Lose?
Second. Lose your
Smell.
Smell, yeah, sense of smell or taste.
See, the COVID virus goes into the nasopharynx. That is, imagine you go from the nostril backwards, in between the eyes, where when you lie down, do like that when the phlegm comes from. That is called the nasopharynx. And that's a place where we have got 2 olfactory bulbs just beneath the brain. From the olfactory bulbs, we have got those olfactory nerves, smell nerves. So as this virus attacks the mucosa here, the mucosa is destroyed. The mucous membrane is destroyed. So the nerve fibers are unable to take the smell. And once the smell goes, the taste also will go, because smell is always intricately connected to the flavor, the taste.
Thank you, doctor.
Thank you, doctor. I have a question to add to that. Doctor, I am Pranati, who asked the same question. So I have heard like a person who is affected with a viral infection is also tested positive for coronavirus when they do a RT-PCR or antigen test. So how are they like connected? Viral infection testing positive?
You mean to say that false positive? That is, he's not having corona but getting tested positive.
Yes.
That's possible. See, all the test procedures, what they are going to look for in the laboratory is a sequence of molecules in the final stage that is amplified with a polymerase chain reaction. So it is possible. A viral infection can cross-react, but very few. Now, in some individuals, it is understood that this COVID virus can leave a small portion of its this ribonucleic acid material inside the system, and this may be detected. That is why RT-PCR, if you remember earlier, we were insisting to get an RT-PCR for negativity. Nowadays, after recovery, the government strategy is either antigen or RT-PCR. RT-PCR is not a must. I have a patient who has remained 3 months, full 3 months, after complete recovery, RT-PCR positive. That's possible. I hope I have answered your question.
Yes, thank you, sir.
Thank you, doctor. Mr.
I found a vascular surgeon logging in. Yes, tell me, sir.
Yeah, Mr. Venkat is asking, my age is 35. I am diabetic, infected with COVID with minor symptoms. Post-COVID, I am suffering with chest pain and took Budamate 200 for 30 days. And ecosprin for 30 days, as per doctor's prescribed. Still, I am feeling stress in chest. Please suggest me what treatment required for it.
See, was budamate given only for this purpose? Then you may continue. Or did you have any bronchial asthma or chronic obstructive pulmonary disease earlier? Because budamate is basically used for either of the two, right? That's number first we have to understand. Second point is diabetes has to be controlled. There is no two ways about it. That is, your HbA1c must be below 6.5 or at least at 6.5, not more than 6.75. So if you achieve that control and then you do breathing exercises, that's all you can do at the moment. Then some doctors give acetyl N-acetylcysteine, what is called, it's available as Lumenac, Mucinex, Pulmoclear and all that to improve the innards. So you may ask your physician whether it is advisable for you because you're feeling the chesty feeling inside, and breathing exercises and cupped hand pumping, as I told you, is very good for such people.
Thank you, doctor. Mr. Abdul is asking, a month ago, my father recovered from COVID, but he is having cough, sneezing, and he tested CBC, CRP, TB, and took X-ray, and all are normal. So that we have to do to recover from these.
Yes.
So what we have to do to recover from these symptoms?
Age of the individual is around 70, 60. I hope, presume, yeah. So at that age, after 50 or 60, we all have some 60 years, yes, 60 years, he must be having some deficiency of his lung function. More so if he had ever smoked. Now, even if he is a non-smoker, some amount of loss of lung function is usual. Now, the virus has come. It has produced a further decline in the number of alveoli, useful alveoli. So this may persist for some time. So whatever treatment the physician has given you, please continue that and deep breathing exercises and tell him not to exert. Take it on his shoulders to do manual labor immediately. That's all I can suggest. There's no drug as such.
Okay, thank you, doctor. Here is a question from the vascular surgeon here, seeing a lot of post-COVID thrombosis. How is your experience? And also, again, does budesonide inhaler help in post-COVID fibrosis or cough?
Yes. Yeah. Thank you for this very important question. Fortunately, at least in Trivandrum where I work, thrombotic incidents are very few. I don't know the reason. Maybe we are very early. Maybe we are very proactive. I don't know what this thing is like. We have got 3 major private hospitals, 5 medical colleges in the district, and a government, including 1 government medical college. So altogether, we are talking about something like 2,000 ventilator beds. And incidents of thrombotic complications are, I don't know why, not very common. That is our experience here. The second part of the question was, sir? What was the second part of the question? Other than that?
Again, does budesonide inhaler help in post-COVID?
That's true. In fact, when a person is admitted, even before you start oral steroids, if he has got severe recalcitrant symptoms, including a cough, in COVID, what I find is this dry, irritant cough is a very, very difficult symptom to control. You give cough syrups, you give cough suppressants, of no avail, because it is the alveolar inflammation. So there, it has been very well supported in several studies, and I have been routinely using budesonide nebulization. In a little more symptomatic cases, I would give it 8 hourly, otherwise twice daily. It is very useful, and on discharge, I am prescribing a pressured metered dose inhaler, preferably with a spacer for the elderly. I hope I have answered your question, Dr. Saab.
Thank you, Doctor. So BM Swami is writing, our patient aged about 55 years, discharged from COVID hospital, diabetic, affected after COVID infected, around 40 mg per DL. Earlier, she was highly BP, taking tablets, having severe cough. Also, she addicted from tobacco earlier days. Also, she struggled more than 15 days in ventilator. 1 second.
May I answer the question, sir?
He reached around saturation level 81% with 50 liter per minute oxygen, LT per M.
Liters per minute.
She's now at home. Now also cough, body pains. Can you tell me the further risk?
Yes, sir, he had a fairly advanced moderate disease, not very severe, but advanced moderate disease, short of going onto the ventilator. It was very well managed, I'm sure. And now, as I explained earlier, at this moment, you can check the last X-ray with your doctor, whether it had showed some changes. If so, 4 weeks later, you can repeat an X-ray and compare, number one. Number two, CRP will tell us whether there is still active inflammation. Then 3, deep breathing exercises, adequate hydration, and if he's having symptoms like cough and wheezing, inhalational therapy is a good idea. Discuss with his physician and start inhaled steroids. It might help him.
Thank you, Doctor. Smita is writing, can the alveoli recover over a period of time?
So if the inflammation is mild, yes. But if it is moderate or severe, we may lose some alveoli. So it depends upon to what extent the alveolus was damaged before we started anti-inflammatory therapy. So the idea is to watch and interfere at the right time.
Okay, thank you, Doctor. Mr. Umobin Sheikh is saying, I am third-year medical student, sir. We students are offering telecounseling services with the guidance of our staff.
Good.
And this false positive reports have caused too much of stress to the people, since we are for now asking them to extend the quarantine to a...
No, I wouldn't do that. The RT-PCR false positivity, it's not exactly false, but it must have been a recovered case also. Yeah, some amount of false positivity and false negativity is accepted in every test, in every biological testing. You will not find any test where it is absolutely 100% positive. So what we can do is, if a person is tested positive, do a general examination parameters, show that his temperature is normal, his blood counts are normal, his ESR or CRP is normal, and then if he has had a reasonable period of 14 days of quarantine from the initial, declare him fit to rejoin his work. There is no sense in 3 to 6 months extension of quarantine is not warranted.
Yeah, thank you, Doctor.
Yeah, sir.
Yeah, go ahead.
Sir, most of the people we are offering counseling services are of lower socioeconomic background. So we couldn't order more tests for them too. So what shall we do in that case?
Do an antigen. Show that antigen is negative. Rapid antigen test is only 300 rupees.
Okay, sir.
So that will be, rather than repeatedly doing RT-PCR, which we know that can stay positive for some time, tell them this is good enough. Government now says the antigen test is good enough.
Okay, sir. Thank you so much.
Good evening, sir.
Good evening.
Yeah, I'm Mr. Tom from Mangalore.
Yeah.
I had an attack of COVID, and I was in the hospital for about 10 days. And I had severe cough from that time onwards, but now it's much reduced, but still certain amount of that dry cough irritates. And my sugar level had gone up due to the steroids at that time. Otherwise, it was just borderline. Now that also with the insulin therapy, it has come down. Now I'm on tablets. So will the cough, will it take still time to reduce?
It might. As I was suggesting, get in consultation with your physician, try inhale steroids, it might help you.
Yes.
That is fairly safe. We know for asthma and COPD, we have been using it for donkeys number of years.
Yes.
Probably you may be having a little bronchitis, chronic bronchitis, which might have got aggravated with your diabetic status and the current condition. So that is what I can suggest. Please consult your doctor before starting the steroids.
And I had taken 1 dose of vaccine. Then only this COVID took place. Now it's when can I take my
3 months?
3 months.
3 months from the date of recovery, sir.
Yes.
And then you can take the second dose of vaccine.
So thank you very much, sir. It was highly enlightening.
Can I ask a question?
Yeah, of course.
See, we are seeing a lot of mucormycosis in Tamil Nadu. How bad is it in Kerala? And what do you think is the reason why there is sudden spurt of mucormycosis?
Yeah. Well, sir, my experience has been nil in this regard, at least. Trivandrum, there is hardly any case. The anecdotal cases reported elsewhere in the state, 1 or 2. See, the reason, of course, as people say, dirty tubings or whatever. Now, this virus infection suppresses your immunity, especially cell-mediated immunity to resist these organisms. As you know, the vegetative form is not transferable. A person A cannot transmit it to person B. It has to be the spores which are in the soil. So these spores are there in everywhere in our country, especially in a damp climate like that of South India, especially including Kerala. But what is important is to maintain cleanliness to maximum extent. When I go for a water round, the first thing I ask my sister is, when did you change the water inside the flow meter? And get it changed every day. Every patient, after use, you have to change it. Similarly, sterilization. See, if a person is using a mask, we don't give it to anybody else. But the same mask, the same person, we have to sterilize it. Some of these masks are boilable, but others which are not boilable, we have to use Sidex or something and proper sterilization. As I said, personally, I don't have much of an experience in treating them because we are lucky in Trivandrum, not very many cases have been reported.
As you said, there's a very low incidence of thrombosis and mucormycosis in Kerala. So just wondering, what is the
the secret? I don't know, sir. Maybe.
Srikumar is a very good friend, actually. We are all colleagues, vascular colleagues.
Oh, I see.
You must know Srikumar, vascular surgeon?
Yeah, of course.
This is Dr. Ramurthy.
Yes, sir.
Actually, you must be knowing Professor KVS Mani.
Yeah, of course.
He is my classmate.
Thank
you for an excellent presentation.
Oh, great, sir.
We are very much thankful to you.
Coming from a senior person like you, I mean, it's a real, my day has been made, sir.
Okay, thank you. Thanks a lot.
Pleasure is mine.
That is my father, actually. He sent me the link for the meeting.
Okay, good. In fact, a couple of my classmates from United States were supposed to log in. I don't know whether they have logged in. The difference in time being what it is. Yeah.
Do they have any different strategy abroad for abroad? The medicines, are there any different medicines used abroad for post-COVID fibrosis?
No, sir. In fact, the studies are still underway. On an experimental basis, people have been giving in clinical trials. They have been using this sulfonylurea, then nintedanib for fibrosis. Then other strategies, including N-acetylcysteine, but no specific this thing. But a lot of interferon use. It's triple expensive, 12,000 rupees for a dose, but single dose is good enough. It's being tried elsewhere because for them the problem is the FDA approval is more tight than our DGCI. Any other questions, sir?
Good evening, Doctor. Hello.
Good evening.
Doctor, thank you very much for having a good presentation today. Hello.
Thank you. Thank you.
Hello.
Yeah, we can hear you.
Doctor, can you be able to hear me, sir?
Yeah, hear you.
Sir, both my wife and I were affected with COVID and were admitted to the hospital and were given steroids treatment and as well as remdesivir for 5 days. And afterwards, we were discharged 25 days before. Basically, I'm a diabetic patient and I was asked to have this anticoagulants for 15 days. How long should I continue to take this anticoagulants, sir?
See, did you have any coronary artery disease or cerebrovascular disease?
No, sir. No, sir.
In that case, 15 days to, 2 to 4 weeks is usually enough. So your treating physician would be a better person. But I would suggest at least some ecospirin or clopidogrel, being a diabetic, ecospirin especially, maybe continued after the anticoagulants. What did you take? Apixaban? Rivaroxaban?
Apixaban 5 mg, sir.
Yeah.
Yes, sir.
So,
and sir, second question.
Yeah.
Sir, second question. After discharge for 1 week, my wife got some swelling on the face, cheeks and all. But it is suppressing when after she wake up in the morning, or sometimes likewise. It was almost 20 days this was happening. Anything is it associated with and need to be attended?
No cause for concern, sir. Swelling of feet, swelling around the eyes.
Swelling in the face, sir. Not in the feet.
Face is known, sir.
Yes, sir.
Is known.
Sir.
Severe weakness, prostration.
Okay.
I'm just unable to get up from the bed type of feeling is known,
sir.
But it will go away. Yeah, give her. She's also a senior citizen.
No, she's just 45 years old.
45. But then perimenopausal, please supplement calcium. If she doesn't have any stone disease. And
no, she doesn't have it.
And get her sugars checked too, sir.
Yes, sugars almost every 2 days because of this steroids administration we are checking and everything is under control for both of us, sir.
That's good enough, sir. Thank you.
Thank you very much, sir. Thank you to have a good presentation like a senior colonel doctor. Thank you, sir. Thank you.
Thank you, doctor. We have another question.
Yeah.
Is it possible to, from Ms. Smita, is it possible to get a false positive report of an RT-PCR test just as we get the false negative reports?
True. It's both are possible. Smita, it is definitely possible. Both false positive and false negative are known. But when we have got symptoms, we have got signs in the lungs, we have got X-ray, and if RT-PCR is negative, the teaching is treat the person as COVID, whether RT-PCR or not. Similarly, when it is repeatedly RT-PCR positive, and if there are no symptoms or symptoms have improved, CRP is normal. Do an antigen, negative, happy. Pardon? So I hope, Smita, I have answered your question.
Thank you, doctor. Yes, I think.
Anybody else want to ask any more questions? I'm glad
I think, someone is asking for, I think Leela. Yeah, Leela Maheshwar, you have a question to ask?
Yes, sir. Yes, sir. Happy evening to all. First of all, I am very much thankful to Dr. Rajan, sir. Sir, excellent PPT presentation. So I have a question on behalf of all the 18 plus groups, sir, regarding vaccination. So vaccination right now, it is available only Covishield and Covaxin. So the question is, some people are employees going outside, right? They are not having the vaccination and they are going for the jobs right now. So government is saying that first dose, after taking the first dose, the second dose of Covishield can be taken after 82 days, something like that. So is there any chance to take Covaxin as a first preference, or Covishield can we take like that also? So Because Covaxin is having 28 days of duration to take the second dose. So in that way, I'm asking the queries.
Firstly, let me tell you, even the first dose is very effective, number one. Number two, why have we kept this 84 days? Because the immune response with the first dose, gradually the antibodies start climbing. And after sort of the 12 weeks, when you give a second jab, then is the best form of antibody response. That's the reason. Now, regarding Covaxin, on the other hand, it can be taken after 4 weeks. Now, the situation here in Trivandrum is when this vaccine is available, the public health department says institutions and which vaccine is available. So you ask for an appointment on those institutions where, am I visible?
Yes, sir.
Yeah, we can.
Which I mean, like if I want Covaxin, I go to that particular institute where Covaxin is available. That's what I can do. In your state, I don't know how the situation is. So
in Karnataka, Covishield is available, sir. A lot of doses are available in Karnataka. Covishield. Covaxin is also available, but in PHCs only. So not in a private this thing. A lot of private hospitals are not having Covaxin.
Achha. So yes, then I may not be able to help you in that.
So
okay, thank you.
A lot of known persons are asking. So we are waiting for Covaxin. That's why I queried actually. Because the second dose duration is very little, right? So within a month, after 1 month, they can take the second dose.
True. That's an advantage.
Yeah, that's the advantage. Thank you, Doctor. Yeah.
Thank you, sir.
Thank you, Doctor. So anyone else? I think Doctor has been with us, for 1 hour 15 minutes. We should, we are thanking the doctor from the bottom of our heart for spending his time and expertise and knowledge with the rest of us to give courage to face this pandemic.
Thank you, Rajan sir. Thangam.
Oh, thank you, ma'am.
Good. Okay, it was very good presentation. Thank you so much.
Thank you. So, any other quick questions for the doctor? Otherwise, we can.
Sir, only we want to say thanks to doctor and host Ramesh sir and his team.
Thank you.
And my request is please kindly upload this.
May I speak?
Yeah, please.
Dr. Rajan, thank you so much. I was immediately interested in your presentation and I registered for it because my cousin also was an AFMC graduate, Dr. Prabir Chaudhary. He is no more. And I've got great admiration for AFMC graduates, pass outs. So I registered and thank you so much. It was very, very informative.
Thank you very much. In fact, both my post graduations are from AFMC, both MD Medicine and MD Respiratory.
Yes, doctor.
And I was the HOD there.
Yes. Thank you so much. You cleared a lot of my doubts. I had more questions, but it will take a long time. So I'll just hoping you will come on again and do one more presentation.
So that would be a good idea, Dr. Rajan, whenever maybe in another next 2-3 weeks time we will pick a time. Yeah. Then maybe there will be more people who would be interested in listening. We can have a follow-up session. Okay, any other quick questions for anyone? Otherwise, we can wind up for today and we will.
And Dr. Rajan, today I got one inquiry from Delhi COVID Jankari Delhi group. So if they ask for a session, we'll come back to you, sir.
So, see, a doctor is a teacher, he's a preacher, and always ready to offer help. No problem.
Thank you, sir. Yeah.
So we are so grateful to you. So Abhijit, anything else we have to do now today, or we are good?
No, sir. I think we can wind up if nobody having any questions. And so once again, I really thank Dr. Rajan for providing us more details about post care COVID post care, and also regarding the co-vaccine and all. And also I thank every participants who attended the webinar also. Thank you again. Thank you, doctor.
Okay.
Thank you and good night.
So yeah, thank you, and good night, everyone. Thank you, special once again. Thanks, Dr. Rajan. Yeah.
Thank
So
you.
we'll see next time.
Sir.
Thank you. Thanks a lot.